Good afternoon and welcome to A Leader's Guide to Mental Health in the Workplace, brought to you by Hire for Talent, a national awareness campaign delivered by the Restigouche CBDC, along with Kristin Bauer of Leda HR. Before getting started, I would like to mention that we do have simultaneous translation being offered. You can select your preferred language under Interpretation along your bottom menu. So I'm Tassia Casey, a communications agent at the Restigouche CBDC, and would like to thank you so much for joining us here today to talk about such an important topic that leaders are presently experiencing challenges in, now arguably more than ever. I'm joining you today from the traditional, ancestral, unceded territory of the Mi'kmaq First Nations on which we are learning and working. So I'd like to mention that we will have a 15-minute Q&A at the end of the presentation. However, feel free to send along your questions at any point throughout the presentation in the Q&A. As I mentioned, I'm joined today by the talented Kristin Bauer, a partner at Leda HR. Kristin brings with her 2 decades of human resource experience creating equitable and inclusive workplaces to a wide variety of clients as an EDI consultant. She has led work in areas of EDI strategy development, disability and inclusive employment programs, mental health awareness and psychologically safe workplaces, intercultural competency and unconscious bias training, and reconciliation in Indigenous history. Kristin has also been recognized with Open Door Group's Untapped Award for her mental health advocacy work. Kristin, thank you so much for joining us today. We're so happy to have you here.
Thank you, Tassia. I am absolutely delighted to be here today and to be talking about something that I think is such an important and certainly timely topic. I too would like to take a moment to acknowledge and to express my deep, heartfelt gratitude to Indigenous people who have been the traditional custodians of this land. I'm joining you today from the West Coast, and in the Metro Vancouver area, this is the traditional and unceded territory of the Coast Salish people. That's largely comprised of the Squamish, the Musqueam, and the Tsleil-Waututh First Nations. I'm in an area called Maple Ridge, and this is the land of the Katzie First Nation. So let's get started. I think it's pretty fair to say that seemingly overnight, our worlds changed. 2 years ago, when we're heading into 2 years now with this pandemic, it's 2 years later and we're still living and working in less than ideal circumstances. And many of us are working from home. Many experts have compared this experience to stages of grief. So we are all collectively and individually grieving a way of life. And certainly all of this has had quite a profound impact on our mental health and our overall well-being. You may have heard the term shadow pandemic. This has been used frequently over the past 2 years because of the increase in mental health challenges. The rates of depression and anxiety have greatly increased. Angus Reid did a research study about, I'd say, March of 2020, or March of 2020. And what they found was quite a sharp increase in mental health challenges, even within a month or two of having started the pandemic or starting to experience the pandemic. So prior to the pandemic, and you've probably heard this statistic, 1 in 5 of us would experience a mental health challenge at some point in our life. Fast forward about 2 months into the pandemic, and what Angus Reid found is that 40% of us, 40% of Canadians in that moment were experiencing a mental health challenge. And I'm certain that everybody on this webinar today has had either, if they haven't had an impact on their mental health and well-being, certainly somebody that they care about or somebody in the workplace that they're close to has experienced it. So we have seen exacerbation of pre-existing mood disorders, anxiety disorders, and things such as addiction and eating disorders as well, which are also mental illnesses. And for many, the workplace is now in our homes. So that line between work life and home life is completely blurred. So we can't now really fully separate what's happening in our personal lives from what's happening in our private lives. In our work lives. So I don't know if this would be surprising to anybody here, possibly, but the World Health Organization has identified depression as the single largest contributor to global disability. So if I were to come into your organization without even looking at your data from your benefits provider, I could tell you that the number one category is most likely attributed to mental health challenges. More than 80% of people experiencing mental health conditions, and this is a pretty staggering number, don't receive the appropriate treatment. And that's really largely due to stigma. We feel a sense of shame, largely, if we're experiencing a mental illness, so we don't ask for help. When you factor in the rates of unemployment for people with disabilities, this impacts the ability to receive medication and services that are often covered by employee and family assistance programs and benefits. So we can see that there's now a compounding effect. And the truth is really that many people with depression or some sort of a mental illness, they're quite capable of working with the right supports. And certainly there are a lot of benefits as well to staying in the workplace, even if you have a mental health challenge. So let's talk a little bit about what causes mental health challenges and issues. A lot of times people will say, and I will share, I'm a person with lived experience with depression and anxiety, and people will say, oh, well, what happened? What triggered it? And it isn't always a trigger. Sometimes there are a number of factors that come into play. So this is some statistics or some data from the Canadian Mental Health Association. And how they've broken it down is into 4 buckets. So 15% of what determines our mental health is our biology. So just like you may have within your family, a genetic disposition perhaps to diabetes or cancer or heart disease, you can also have a genetic predisposition towards mental health challenges. That's certainly the case in my family. 25% is healthcare. So things like, what are our wait times? What is our access to healthcare? And certainly this is another thing that we've seen in the pandemic, is that because we've had to take a triage effect and have had to deal with increasing cases of COVID, some other surgeries and perhaps things that are deemed less essential have been pushed back, and that's having an impact on our mental health. 10% of this is the environment. I think this is a really interesting one. Cities that have more green space, that's healthier for us. It's healthier, if we have more access to parks. Interestingly, there was just in the news yesterday that the province of British Columbia has this new option where doctors can actually prescribe a pass to a provincial or a national park for those who have a mental health challenge. So we know that the environment can be a really important element. But here's the really big one, our life. So all of these factors, certainly this isn't everything, but as you can see, there's some really important factors that are part of our life that will really influence how mentally healthy or if we're experiencing a mental illness. So things like our income, again, and I go back to what I was saying, if you're unemployed and you don't have access to income or those benefits, that's going to have an impact on you. Disability, if you have a disability, you have a higher chance of also having a mental health challenge. Things like education, social exclusion, which certainly we've seen in the pandemic. We're not able to gather and connect with people as we once were. Gender is an interesting one. Women are more likely to experience a mood disorder. Men, sadly, are more likely to die by suicide. And certainly that there's a large stigma element at play there. Men don't want to talk about it as much as women. And things like our race, Indigenous status, safe and nutritious food, what we put into our body is really important. And if you are experiencing poverty, you likely don't have the income to be able to buy nutritious food. And things like housing instability as well. The one that I've highlighted here, which is certainly very relevant to our conversation today, is our employment and our working conditions. This is really a big one when you consider how much time we spend at work. There are many, many mental disorders. We certainly don't have time to go into all of those today. So I've really highlighted the 4 ones that will certainly have an impact in your work environment and are the most common. So depression and anxiety are the 2 big ones. And I've also included addiction and eating disorders here. Addiction is often misunderstood. I would say probably the mental illness or disorder that has the most stigma attached is addiction, because we often view it as some sort of moral failure, and it isn't. There are a lot of reasons why people choose to self-soothe through alcohol and substances. And at the start of the pandemic, when basically our country was locked down and we couldn't go to stores were closed, grocery stores were open, liquor stores were open. And at first glance, you might think, well, why is that? That seems silly. But there was recognition early on that there are people who are struggling with addiction, and to cut them off cold turkey would actually be a very harmful situation and would add to the strain on our already strained healthcare system. And then eating disorders. Eating disorders is another way that we will often turn to food to self-soothe. We will eat too much or too little, and that's because it's a way of we think of gaining a little bit of control at a time when we feel like we have no control. It's really important to note here as well that some medical conditions can present as some of the symptoms that these mental illnesses have as well. So, and I will go through some symptoms to watch for, but I highlight that because it's really important to see a healthcare professional. When I was diagnosed with depression, and actually subsequently when I've had relapses, I've always gone back to my doctor, and he always tests me for things like my thyroid, just to rule out if there is anything else that could be at play. So these are some of the symptoms of depression. Not everybody has all of these things. Every person is different and will experience different things, but these are some of the very common symptoms and really classic hallmarks of depression. A lot of times people think, well, it's just about being sad. Sometimes it is. Sometimes it's a complete absence of any sort of emotion. You feel like you don't feel anything. I once heard Michael Landsberg, the sports broadcaster, speak at a conference years ago when he said, I will compare my depression to winning the lottery. And you win the lottery and that's a really exciting thing and you should be happy, but you feel nothing. And so some of the other things here as well are, loss of interest in things that you might have loved to do before. You don't have the same energy, you feel fatigued, you either can't sleep at all or you sleep too much. And some of the things that are really important to consider for those who are experiencing depression and also trying to keep working is things like difficulty concentrating, making decisions. There's a real cognitive impact to mental health. And the final thing on this list that I will just highlight briefly is thoughts of death or suicide. So what I want to put out there right now is you are not alone. If it's you who feels this way, or if it's somebody that is close to you or a colleague, you're not alone and there is help. So I've put this number in here. And I just want to pause at this moment too, and to say that, if there is anything in this content today that perhaps touches a nerve for you or triggers something that you're feeling, please reach out to somebody close to you, somebody you trust, if you have one, your employee and family assistance provider. Please talk about it. So the next one here is anxiety. Anxiety is a very physical mental illness. There's a lot of physical symptoms that go along with this. Again, we see sleep disturbances, really common. Anxiety, not being able to stay calm or still, that sense of fight or flight or freeze. And then the physical things, so cold, sweaty, numb or tingling hands or feet, shortness of breath, heart palpitations, dry mouth, nausea. These are very, very common with anxiety disorders. So how does this connect to the workplace and your employees? or your colleagues. Here are some of the things to watch for and to look for in your team, your employees, that could be indicators perhaps of a mental illness. Were they normally typically on time and very, no sick days, no care days? Has that changed? Have they become more irritable? Is there an impact on interpersonal skill or interpersonal relationships within the workplace? What about their goal setting? Have they become unrealistic about their goals? Maybe they're being having too grandiose of goals, whereas before they were perhaps more logical or achievable. What about their time management? And then also changes in appearance or personal hygiene. So these aren't all necessarily, going to be an indicator that somebody is ill, but they certainly can be. And this is really why it's important to have a connection with your employees and to understand how they typically show up, what their personality is like, what their work style or skills and preferences are, so that you notice when things will change for them. So I want to talk a little bit about ableism, because it's really important when we speak about mental health and the workplace that we talk about some things like ableism and stigma, and really about misunderstanding. So ableism is the expression of a discriminatory preference for someone without a disability. It assigns inferior worth to people who have a disability, and mental illness is a disability. It's classified as such in Canada, by devaluing and limiting that person's potential. So we start to assign worth, and often we do that unconsciously. So in terms of mental illness, it includes things like belittling the need to take medication, or the need for time off to attend doctor's appointments, or even increased sick days. So it's, well, can't you just get it together? Like, what's wrong with you? Why do you need medication? Go for a walk. It's not as simple as that. And really, when we're talking about ableism, we're talking about microaggressions, and those are really a form of unconscious bias. And when we're speaking about unconscious bias, we're making assumptions about people that are not always based on truth. So let's talk a little bit now about something that I know is tricky for managers sometimes, is to ascertain if the changes that you've seen, these behaviors that are showing up with your employee in the workplace, is this bad behavior? Do I need to performance manage this person, or is this illness? And if there's any HR people on the webinar today, this is going to be a really familiar concept for them, which is, culpable versus non-culpable behavior. And this can be a tool in your leadership toolkit that can help you to decide, which path am I going to take with this employee? And it can be really difficult sometimes to tell the difference between poor behavior and symptoms of an illness. And absolutely unconscious bias can really cloud our ability to assess an employee's performance. Frankly, it can get in the way of determining how best to support them. So when an employee's performance is not meeting expectations, or perhaps they're showing signs of what we interpret as bad behavior, it's really important to consider the following concepts before you decide on the course of action. So these are the two key classic HR questions. Is the behavior culpable? So did they know what was expected of them? Or is the behavior non-culpable? Did they not know what was expected of them? And if we go back to that first question, is the behavior culpable? Did they know what was expected of them? If you can say yes, they did know, but this is so out of character for them, this is when you start to have to ask. You need to ask some questions to be able to dig a little bit deeper around this. So how do you decide what path to take? You need to start a conversation. Now, this is perhaps the number one question I have been asked by managers about how to support an employee with a mental illness in the workplace. What do I say? How do I say it? And really, it's a pretty simple question. I notice that you don't seem yourself lately. And then what you do is you pause, you don't talk, you leave a little bit of space, even though that is uncomfortable. We don't like to leave space. But really what you're doing is you're just opening up a conversation. And this is really important. And I can tell you that this works, and I know it works because a manager used this approach with me probably close to 15 years ago. I was brand new in an organization. I was really keen to make a good impression and to, start to do a good job and meet all of these expectations. And I was struggling personally with my mental health. I was starting to have a recurrence of depression. And my manager, who actually didn't know me that well, but she knew that there was a change. She knew that something had shifted for me. And she said, I noticed that you don't seem yourself lately. And luckily, there was a level of trust between us. And I was able to say, yeah, you're right. And this is what I'm going through. And it opened up a conversation whereby she better understood me. She created an opportunity for us to have dialogue. It built some trust, some more trust with us. And most importantly, she knew then she started to understand how she could support me. We could figure it out together. And I will say there is a legal imperative. There's a legal duty to ask if you think that an employee is experiencing a mental health challenge. And so I want to now introduce two legal, perhaps boring, but some legal concepts that are really crucial to this conversation, which is the duty to inquire and the duty to accommodate. So the duty to inquire is this, and again, the HR folks will know this well. Managers who think that an employee may be struggling with a mental health challenge have a legal duty to inquire. So simply put, if you think somebody's struggling and it's mental health related, you have to ask them. So go back to that question. If you don't want to come right out and say, hey, I think you have depression, because of course you're also not a professional psychologist or a psychiatrist, just open up the conversation. I noticed something is different lately. And if they say, yes, I have depression, or I have this, or I have a mental illness, and by the way, they don't have to tell you what their diagnosis is, but if they do say, yes, I have an illness and a disability, here's the other important legal imperative. It's the duty to accommodate. So every employer in Canada is required by law to accommodate an employee who has a disability up to the point of undue hardship. So if you are a small organization, maybe you've got 2 employees, your level of undue hardship is going to be, or your threshold is going to be much lower than, say, an RBC or, some other huge, Facebook or some other huge organization. Because you're not going to have the same financial resources or just resources in general to provide accommodation. But the good news is most accommodations, over 90% of them, cost under $500 and are really simple to implement. So we know we have to have conversations, but those can be hard. How do we talk about things that are really, really personal? And so I want to give you some tips now to approach psychologically safe conversations within the workplace. Because if you don't have that level of psychological safety, it will be virtually impossible to have an effective conversation. So the first tip here is to approach the conversation with empathy. And if there's one thing that you can take away from our time together today, it's empathy. It's a really key element in inclusive leadership, but certainly when we're talking about mental health in the workplace. And I'll talk a little bit more about that as well. So, we know that having a one-to-one meeting between, whether it's you and your employee or you and your manager, those things can be stressful sometimes. even if you're talking about good stuff, because there's that hierarchy and a bit of a power dynamic there. So, if it's about their performance or something personal, like a mental health challenge, that can be a scary situation for somebody. So it's really important to let the person know that you care and that you want to help them. The second point here is to choose curiosity over judgment. I will tell you, this is, it's absolutely a game changer, and it has been for me in my life and in my work. Our brains are hardwired to make decisions quickly, to go to a place of judgment quickly, because that's how our brains make order out of the world. But if you find yourself having a judgment about something, whether that is good or bad, I really encourage you to pause. Pause and be curious about why you're having that reaction. So if you have an employee and you're frustrated with them, you think, God, why can't they get it together? What is going on? Their work is sliding. They're always late. I'm really mad about this, and I'm going to have a conversation with them about their performance. Pause and think, I wonder why those things are happening. I'm just going to be curious for a minute as to why those things are happening. So, when talking to an employee, please keep in mind that if that person has a mental health challenge, it can be really easy for unconscious bias to creep in to that conversation and into, how you perceive that person. And this is not going to be surprising to anybody, I'm sure, but research from John Gottman at the University of Washington shows that criticism can escalate difficult conversations. So, if I were to say, if I'm your manager and I say to you, why did you do it that way? That is probably dripping with, judgment and criticism. But if I were to say, I'm really curious, how did you come about this? How did you make this decision? There are two ways to go. One way is going to shut down any chance of conversation, and the other is going to open up conversation. The third point here is to anticipate reactions and plan for them. So just like when you're having any sort of a conversation with your employee that you think could be potentially challenging, it's good to take a little bit of time just to kind of plan out your approach, what you're going to say, the questions you're going to ask, and anticipate that certainly if this is the first time you're speaking to an employee about a health issue or a potential health issue, they could be defensive. They might become very emotional. So anticipate those things and plan for them. Also, please do keep in mind that one conversation is probably not going to fix anything. And it's also not your accountability to fix a complex mental health issue as well. So please don't feel that pressure. And the fourth point here is, it sounds really simple, but boy, as humans, we have a hard time with this. It's listen first, act second. And I just want to really, really underline what I think is really important for managers to know. This is one area where you don't have to have all of the answers. So please don't feel like you have to have all of the answers and to solve this. That's what, that employee's healthcare practitioner is responsible for. It's not your job. But what you do need to do is you do need to listen, ask curious and respectful questions, and offer supports such as accommodations and information about your benefits that are available through your employee and family assistance provider if you have one. And there are certainly a number of community-based organizations as well that have a lot of free resources if you are an organization that doesn't have an employee and family assistance provider. The hirefortalent.ca website, I'm just going to put a plug in, has a number of wonderful free resources, and soon there will be a set of mental health tools that will be available free for employees and for managers as well. And really, I think the final point here for this list of tips is, just being available to listen is really one of the most important ways that you can support your employee. Because sometimes we just need to talk. We don't need anybody to offer solutions or to fix things. Okay, Did you know that you have some superpowers? You do. You have some very important inclusion superpowers. They're called curiosity and empathy. And yes, I've given you a bit of a sneak peek of those things. This is a quote that I love, and I use it a lot in my consulting work and in the workshops that I do around equity, diversity, and inclusion. Shakil Chowdhury is the author of a really wonderful book called Deep Diversity. The really great thing about this book, in addition to the wonderful content, is that it's Canadian. And so if you're looking to add a new book to your equity, diversity, and inclusion library, I would strongly recommend this. And so what Chowdhury says is, curiosity can help foster understanding, both in ourselves and in others. And empathy can lead to a deeper acceptance of differences, especially when interacting with out-group members. So in-group members are those people that we're most drawn to, that are most like us. Out-group members are the people that are different, that perhaps we don't understand. And so this is a really important concept. In particular, if you are someone who has never experienced a mental health challenge, and you're struggling perhaps to support somebody who is, because it is a complex thing to understand. This is a quote that I love. So I'm getting into my quotes now. I love quotes. Empathy is putting windows in your walls. Empathy is putting windows in your walls. It's really about the ability to recognize and understand the thoughts, feelings, and experiences of another person. It's about attempting to put yourself in another person's shoes. Now, certainly you will never be able to fully understand what it is to walk in another person's shoes, but it's about, taking a moment to really consider what that other person's experience may be like. And again, this is where the curiosity comes into play. I wonder what that person's experiences are like. I wonder what led them to this point. What shaped their beliefs? So curiosity and empathy, again, really, really important. And empathy, I would say, it can be the glue that holds workplaces and teams together. So why is empathy important? This is something that, wow, 5 years ago, if we were talking about empathy and leadership in the same sentence, people would think, no, there's no room for empathy in the workplace. But more and more research is showing that it's actually crucial. And absolutely, when we're speaking about mental health and supporting those who are experiencing mental illness, it's very foundational. So these are things that you're probably not surprised to hear, but research has shown that empathy in the workplace helps you to better understand and connect with others. It builds trust. It helps you to have hard conversations. And boy, there's a lot of hard conversations to be had in the workplace. Absolutely. And it boosts collaboration and productivity. So let's talk a little bit about empathy now. This is your empathy checklist. And so we're going to go a little bit deeper into what empathy is. In terms of building a teamwork culture, we all learn and grow from our experiences, those brainstorming sessions, and meetings and interactions with our colleagues. Teamwork is really the foundation of every great organization. And empathetic teamwork, being able to step back and appreciate someone else's perspective, that's game-changing. So, we don't want groupthink within a team environment. And the empathy piece helps us to understand that people with different perspectives bring greater creativity and innovation to our organizations and our teams. The second point here is around acceptance. So when we talk about, for example, what is inclusion in the workplace, it's where you feel seen and heard and valued for who you are, that you can actually, and this is such a cliched term, but it's true, that you can bring your whole self to work. So you don't have to mask or downplay who you are. I'll give you one of the classic examples is that if you come to work with a broken arm, and your colleagues will rally around and say, oh my gosh, how did that happen? Can I sign your cast? Does it hurt? Like, can I go get you a cup of tea? Because your mobility is perhaps different right now. But if you have a mood disorder or addiction or an eating disorder, We don't like to talk about that as much because there is more stigma. People are less accepting. The next part here is transparency and authenticity. These are two things also that I think are perhaps fairly new concepts in terms of inclusive leadership skills. But to be transparent and authentic and to be a little bit vulnerable can be really, really powerful. So, as a leader, to say to your team, you know what, this is actually a really challenging time. I'm struggling too. You know what, on the weekend, I was going to do this thing and I just felt like I didn't have the energy to do it. So I just decided to stay home and have a nap. Talk about how you are experiencing and navigating this pandemic. And share that. You don't have to share everything, of course, but to be able to share a little bit of what you're going through builds connection. And it also sets a really important tone that it's okay to not be perfect. And of course, we know perfection is A, impossible, and B, highly overrated. The next point here, practice gratitude. This is one of my favorite things. I know it sounds corny, but there is research that shows that people who have a daily gratitude practice live on average 7 years longer than those that don't. So if you don't want to eat your spinach or go for a run around the block, practice gratitude. That's going to have a really positive impact on your life. And here's how it translates in the workplace. Tell your colleagues, tell your employees what you're grateful for in what they do. Early on in my career, I worked at the Pan Pacific Hotel in Vancouver. I worked on the front desk as a front desk agent. And there was one manager that I worked with who, at the end of every shift, would say to the team, "Hey, thanks for coming in today. You did a great job." And I'll tell you, if he had to give you, a bit of a performance management conversation because you'd screwed up on something, it was so much easier because he was building that trust and that relationship and that psychological safety. So never underestimate the power of gratitude. The next one, ask questions. I touched on this already. It shows that you're interested. It shows that you're interested in your colleagues, in your employees, in other people's perspectives. Be curious. Taking the time to ask a person how they're doing is a powerful thing. When you think back to the time, for those of you who are working remotely now, but if you were back in the office and you passed somebody in the hallway and they said, "Hey, how are you?" and you started to say, "I'm fine," but they were already down the hallway, that's a pretty inauthentic interaction. So ask questions, but then listen. We don't do this well. We usually ask questions so that we can then respond and share that great idea or funny story that we've been waiting to share. So, to be able to just ask a good question, open-ended, don't feel like as the manager, you have to have any answers. You don't. You just have to ask good questions and you have to create space to listen. So this is something really that is not just for managers, but certainly for everybody. It's how to be an ally. And this is a word that we've heard a lot of, certainly since the horrific death of George Floyd in the US and the really important resurgence of the Black Lives Matter movement. How can we be an ally to other people? Ally is a verb. This is an action word. So see, these are some things. You can find this actually on the Canadian Mental Health Association's website. They've got lots of wonderful free resources. But the first one is ask how you can support them. And again, as a manager, I keep saying this, but I think this is really important because I want managers to take comfort in knowing you don't have to have all the answers. Don't try to figure this out on your own. Engage the employee in the conversation. How can I best support you? The second one is to continue to include them in the usual activities and work. If we reflect back on the slide that I shared around ableism and making assumptions about what people are capable of, if you start to decide that, an employee has disclosed that they're experiencing depression or anxiety, and then you decide, you know what, I'm not going to give them as much work because that might be too much for them. that could have a really negative impact on them. So don't make an assumption. Continue to include them. And if you, for example, if it's maybe a virtual coffee with the team, or when you're back in the office and you want to get together and do something, provide the invitation. If they're not up to it, then they can say, I'm not up to it, but encourage conversation. The third point here is something that I think managers, are really unsure of. So I've got an employee, they have disclosed that they have a mental illness. They've now gone off on a disability leave, whether it's short-term or long-term, and I'm just going to leave them alone. I'm not going to connect with them at all. Again, ask the employee how best they want to be supported. They may want to stay connected with you, because connection and, again, social exclusion, it can be a really important factor in our mental health and our mental illness. So staying connected to the workplace actually can be a really important thing for your employee who's off on leave. But just ask them how they want to stay connected, and if they do. When they return to work after time off, make them feel welcome and appreciated. A story that just really sticks out for me, years ago, I had a colleague who was off on a mental health leave. This person had recently lost a parent and ended up taking a couple of months off of work to grieve. And when they returned to the workplace on the very first day, in the morning, that person's manager said, "I'm really busy today. I don't have time to meet with you." And that had such a huge impact on that person, understandably. So, it's really important to welcome people back, make them feel welcome, make them feel appreciated and part of what's going on in the workplace. And this is something, again, connect with that employee prior to their return to work and talk about what that return to work plan will be. Co-create it with that employee. Now, this one might be the toughest one of all. Model mentally healthy habits. People leaders, managers, small business owners have a higher level of accountability. They've got a lot of things on their plates. And so they can tend to work really hard and really long hours. And so it's important that you, as a manager, also look after yourself mentally. You set the tone. So if you're sending emails at 9 o'clock at night to your team, they're noticing that. If you work through your lunch break, you don't take coffee breaks, you never take your vacation time, they see that, and you're setting the tone. So, don't just tell them, also model them, because not only will these habits be good for them, they'll be also very, very good for you. Now, this is a slide that I found, I think, about a year ago, and I've just saved it because I love it so much. Some of you may recall the Brad Pitt, Edward Norton movie called Fight Club. And the classic line is, the first rule of Fight Club is we don't talk about Fight Club. Mental health is not Fight Club. We can talk about it, and in fact, we must talk about it, because it allows us to connect to other people. If you're a person who is experiencing a mental health challenge and you talk about your own experience, I guarantee you somebody will say to you, "Oh, me too." Or, "Oh, yes, my dad, my partner, my brother, my sister, my daughter." This is a global health issue. And the more we talk about it, the more we bring it out of the darkness. We shine some light on it. And that's when we start to strip away stigma and bias and discrimination. And those are things also that, again, prevent people from getting help, the help that they need, the health care that they need. So I encourage you, keep this in your mind. Mental health is not Fight Club. We can talk about it. So on that note, Tassia, I'm going to pass it over to you for our questions.
Awesome. Thank you so much, Kristin. I've taken away some really great points, and I'm sure that our participants have as well.